10 Secret Symptoms of Fatty Liver. You may very well have fatty liver disease without knowing it, a condition often referred to as a silent killer, lurking in the background, showing very subtle and obscure signs, which is why most people with fatty liver disease don't even know they have it. In this video, we'll be going over 10 of those subtle signs of fatty liver disease, so make sure to watch until the very end to prevent this condition from taking you by surprise, as it does to many people. Number 1. Unexplained fatigue. One of the earliest and most common symptoms of fatty liver is chronic fatigue. You may feel exhausted even after a full night's sleep, or you may find yourself lacking the energy to do simple daily tasks. It's not just feeling tired. It's a deep, relentless exhaustion that doesn't seem to improve with rest. You might feel like you're constantly running on empty. Why does this happen? The liver plays a crucial role in detoxifying the body and storing glycogen, which is a key source of energy. When the liver is burdened with fat, it can't perform these functions properly, leading to a lack of energy. Additionally, the liver's decreased efficiency in eliminating toxins may leave you feeling sluggish, as these toxins begin to accumulate in your bloodstream. If you've been feeling unusually tired lately, it's worth considering fatty liver disease, especially if you also have risk factors like poor diet, high alcohol intake, or a sedentary lifestyle. Ignoring this early warning sign can allow the condition to worsen. Number 2. Abdominal discomfort or pain. Another symptom that is often ignored is a dull pain or discomfort in the upper right side of the abdomen. This pain is usually subtle and might be mistaken for indigestion or gas. However, if the discomfort is persistent, it could be a sign of liver inflammation or enlargement. As the liver becomes more damaged, it can enlarge, putting pressure on the surrounding tissues and organs. This often leads to the sensation of fullness, bloating, or tenderness in the upper right side of the abdomen, just under the rib cage. It's a feeling that may not always be painful, but more like a constant nagging or heaviness. If you notice this discomfort, especially after meals, or it worsens over time, it's essential to investigate further. Early detection can help prevent more severe complications as the liver struggles to process the fat and toxins in your system. Number 3. Unexplained weight gain or difficulty losing weight. Many people with fatty liver disease experience unexplained weight gain, especially around the abdomen. This happens because the liver, which plays a crucial role in regulating metabolism, is no longer functioning optimally. As a result, fat metabolism is disrupted, leading to increased fat storage in the body. Even with a healthy diet and regular exercise, you may find it incredibly difficult to lose weight, or worse, notice that you're gaining weight. This is particularly true for individuals with visceral fat, the deep belly fat that is most dangerous and associated with metabolic dysfunction. If you've tried various weight loss strategies and noticed little to no progress, it may be a sign that fatty liver is at play. Additionally, the liver's compromised ability to process and regulate hormones related to hunger and fat storage could be hindering your efforts. Number 4. Dark urine or pale stool. Changes in the color of your urine and stool are often among the more distressing signs of liver disease. If your urine becomes dark or your stool becomes pale or clay-colored, it's a clear indicator that something might be wrong with your liver. Why does this happen? When the liver can no longer process bilirubin, a yellow pigment produced from the breakdown of red blood cells, it starts to accumulate in the bloodstream. This buildup can result in darker urine. Simultaneously, a malfunctioning liver can affect the production of bile, which is responsible for giving stool its normal brown color. Without enough bile, your stool can appear unusually pale or clay-colored. If these color changes occur alongside other symptoms, it's crucial to seek medical attention immediately. Early intervention can prevent further liver damage and the progression of fatty liver disease. Number 5. Mental fog or difficulty concentrating. Brain fog, often described as difficulty focusing or concentrating, is another symptom that might point to fatty liver disease. While it's commonly attributed to stress, sleep deprivation, or other conditions, a malfunctioning liver can contribute to cognitive issues as well. Your liver plays a key role in detoxifying your body, and when it's not functioning properly, toxins can accumulate and affect your brain. These toxins can interfere with mental clarity, leading to forgetfulness, confusion, and trouble concentrating. In some cases, people describe feeling out of it or unable to perform tasks that once felt effortless. If you feel like you're losing your edge mentally or becoming increasingly forgetful, It might not just be stress or aging. It could be a sign that your liver health is deteriorating and affecting your cognitive function. Number 6. Jaundice. Jaundice, characterized by yellowing of the skin and eyes, is a more alarming sign of liver dysfunction. While jaundice usually appears in the later stages of fatty liver disease, it's important to take it seriously if it occurs. When the liver can no longer process bilirubin properly, it accumulates in the bloodstream, causing a yellowish tint to the skin and sclera, the whites of your eyes. This is one of the more obvious signs that something is wrong with your liver, and it's a signal that medical intervention is urgently needed. If you notice jaundice, especially alongside other symptoms like fatigue, abdominal pain, or dark urine, don't wait. Seek immediate medical attention to prevent further damage. Number 7. Itchy or dry skin. People with fatty liver disease often report having unusually dry or itchy skin. This could be due to the liver's reduced ability to process waste and toxins. When the liver isn't functioning at full capacity, these toxins can build up in the bloodstream and manifest as skin irritation. Dryness, rashes, or unexplained itching, particularly on your arms, legs, and stomach, could be a red flag. The skin's protective barrier is compromised, and it becomes more sensitive to external irritants. In severe cases, the buildup of toxins can also lead to more significant skin conditions, such as eczema or rashes. If you've noticed persistent skin issues that don't seem to improve with typical treatments, it might be time to consider that your liver health is in jeopardy. Number 8. Swelling in the legs and ankles. Edema, or swelling in the lower legs and ankles, is another hidden symptom of fatty liver disease. As liver function declines, the organ may have difficulty processing fluids, leading to a buildup of fluid in the body. This often manifests as swollen feet, ankles, and legs, and in some cases, even the abdomen. This condition might not seem related to the liver at first, especially if you've been standing for long periods, but it could be a sign that your liver isn't functioning optimally. As the liver becomes overwhelmed with fat, it struggles to process proteins like albumin that help maintain fluid balance in the body. This fluid imbalance leads to swelling. If the swelling persists or worsens over time, it's essential to seek medical advice, as untreated edema can contribute to further complications. Number 9. Elevated blood sugar or insulin resistance. Fatty liver disease is closely associated with metabolic syndrome, which includes elevated blood sugar, insulin resistance, and an increased risk of type 2 diabetes. The liver plays a central role in regulating blood sugar levels, and when it becomes overwhelmed with fat, it can't regulate glucose efficiently. When your liver is burdened by fat, it becomes less responsive to insulin, which leads to an increase in blood sugar levels. Over time, this can result in insulin resistance, a condition where your body can no longer effectively use insulin to regulate blood sugar. This, in turn, can lead to type 2 diabetes, which exacerbates liver dysfunction and creates a vicious cycle. If you've been struggling with high blood sugar or have been diagnosed with prediabetes, fatty liver could be a contributing factor. It's essential to address this concern early to prevent the progression of both liver disease and diabetes. Number 10. High cholesterol and triglycerides. Having high cholesterol or elevated triglycerides is often a sign of metabolic dysfunction, which can be linked to fatty liver disease. The liver is responsible for processing fats, and when it's overwhelmed with fat deposits, it can't perform this task efficiently, leading to high levels of cholesterol and triglycerides in the blood. Fatty liver is closely associated with an increased risk of cardiovascular disease due to the imbalanced lipid levels. The liver's inability to break down fat can result in fat being stored in the bloodstream, which can cause plaque buildup in arteries, increasing your risk of heart attack or stroke. If your doctor has mentioned that your lipid levels are out of balance, it's important to consider fatty liver as a possible underlying cause. Left untreated, high cholesterol can lead to severe cardiovascular issues, compounding the risks associated with liver damage. Those were the 10 signs of fatty liver disease. If you're experiencing any of these symptoms and feeling concerned about your liver health, make sure to consult with a healthcare professional. If you recall, the last sign was high cholesterol, which is closely related to liver health and function. If you'd like to learn more about high cholesterol or hypercholesterolemia, check out this video to learn about 12 signs of high cholesterol. Thanks for watching. See you in the next video.